from Group 7 and we will present about anthrax in cattle. So the etiological for anthrax in cattle is basically by the agent Bacillus anthracis, which is a gram-positive bacteria. It is spore-forming and surrounded in a capsule and produces toxin. So basically anthrax, you have three modes of transmission. You have only three routes of entry, namely cutaneous, gastrointestinal, and inhalation, which is by pulmonary. So the mode of transmission for anthrax is mainly by spores. So it gets transmitted when a person handles contaminated animal products and the spores gets into the skin or cuts. Or cutaneous infections happens in ruminants, especially by biting flies. So besides that, there are three symptoms associated with these modes of transmission. For example, if it's for cutaneous transmission, usually you will have symptoms like a boil or some exudative pus coming out from that lesion. For gastrointestinal, it's usually associated with fever, pyrexia, or vomiting of blood. And for inhalation, you will have high fever, dyspnea, and certain other things that are related to the esophagus.
Now I'm going to present you about the diagnosis and prevention and control. For the diagnosis, first we can swab from the peripheral blood and smears from the cervical edema for staining. So when we observe under the microscope, the bacteria should be gram-positive, large, square, and rocks. So we also can use Phaeon polychrome methylene blue stain to stain the sample. So when we observe under the microscope, the bacteria will be surrounded by the thin capsule. For the prevention and control, if there is some outbreak occur, the farmer should be quarantine the farm. Okay. For the all the animal with infected with this disease should be all destroyed. The carcasses should be destroyed, and for the survivor, the vaccination should be they should vaccinate the survivors. For the second, the early recognition of disease is very important because it is one of the ways to prevent and control. The third one, good hygiene. The infected substance should be destroyed by using the strong disinfectant. For the prevention of importation for the products such as wool, should be from anthrax epidemic areas. The carcasses should not be opened but buried deeply into the quicklime because the disease is spread and is transmitted through the inhalation. And the last one is the autoclave suspected material by using the standard condition 16 minutes and 121 degrees Celsius. So I think that's all for our presentation.